So it is my great pleasure to introduce Heather Caliveris. Heather is she's a great resource. She's become a friend, and she's a local Medicare and healthcare expert. She and her family reside out of Perry County here in Pennsylvania. And I do mention here in Pennsylvania because, believe it or not, we do have, I think, a couple people joining us this evening that are actually outside of the state. Um, and so Heather brings with her 19 years, roughly 19 years of experience in the space as a whole. And so we're very excited to have Heather with us this evening to be able to share. What Heather's going to do is she's going to begin sharing on her end. And what she plans to do is throughout the conversation, she's going to open it up for questions. And then again, at the end, we will also, provide an opportunity for questions. If you think of something along the way that, that perhaps you didn't think about throughout when she provides an opportunity to ask. But again, ideally, we really hope that you're able to find some clarity, and get a couple of nuggets from this presentation. And then so again, Heather, I just want to thank you for joining us. Thank you for your time and your expertise and your kindness as I've, myself and Sebastian and others here at Premier have had the opportunity to get to know you. So with that in mind, please take it away.
Thank you so much, Mark. I appreciate the kind introduction. Hi, everyone. My name's Heather Caliveris, and I'm well, depending on where you live here in Pennsylvania, I'm your local health insurance agent. My primary focus is on Medicare, and as Mark mentioned, I have about 19 years experience in this space. Tonight, we're going to review the basics of Medicare, talk about the different parts. I sometimes refer to it as the ABC soup of Medicare, just to provide some clarity around the different parts that you'll hear about, and hopefully bring a better understanding of what those different parts are like and where some focus might be when it's your time to pick Medicare, or maybe you're already on Medicare and you're looking to maybe make some changes. This might bring some clarity in where your focus needs to be in the upcoming annual election period. So I'm going to start sharing my screen here in just a moment. We should be able to see the presentation, correct? Okay. Give me just one moment here.
We can see it.
Okay. All right. So today we're going to talk about original Medicare, including Medicare Parts A, B, Part D, supplemental insurance, and also talking about the different parts of original Medicare that are available for help. And bear with me here just a moment. I just need to minimize something here on my screen so I can. There we go. So what is the Medicare program? The Medicare program is a federal health insurance program offered to individuals who are 65 and older, and also individuals who are 65 and under with certain disabilities. When we think about the different parts of Medicare, we think of four different parts. Traditionally, we have Medicare Part A, which is hospital insurance, Medicare Part B, which is your medical insurance. There is also Medicare Part C, which is more commonly referred to as Medicare Advantage. You'll see here on the slide, it says it replaces Part A and B coverage, and I'll better explain what that means. And some of these plans include Part D coverage. Part D, you can see there, is what we refer to as the prescription drug coverage with the Medicare program. When you think of original Medicare, that is referring to Parts A and B. Most folks sign up for original Medicare Part A and B on their own. However, some automatically get signed up. So original Medicare A and B is going to cover your hospitalization and your doctoring. With original Medicare, you'll pay monthly premiums, deductibles, co-insurances, and co-payments, excuse me. You would also need to find coverage for your prescription coverage. Medicare Part A is what we think of as your inpatient hospital coverage. Now, under this umbrella, that also includes skilled nursing, home health, hospice, inpatient blood. There are certain rules and limitations. For example, skilled nursing care is only following an inpatient hospitalization of 3 days or longer. If you're not familiar with skilled nursing care, just as a little sidebar there, that would be what we refer to as intense inpatient rehab. Oftentimes, it's in a situation where maybe somebody has a hip replacement surgery. They're well enough to leave the hospital, but not quite well enough to get around at home yet. They might go to a skilled nursing facility temporarily for some rehab. With Medicare Part A, most people have a premium-free portion. If you or your spouse have worked at least 40 quarters, there is no monthly premium for Medicare Part A. If you did not work your quarters, you can see here that there are varying premiums depending on how many quarters you did work. But in my experience, honestly, I have yet to come across somebody that has had to pay for a Part A premium. So it doesn't happen often, but it can. When we think about original Part A cost on their own, there is a deductible for each benefit period. A benefit period can reset every 90 days. So in one calendar year, you can have a few different benefit periods. Um, right now, a benefit period deductible is $1,676. If you had original Medicare A and B only, you would be responsible for that deductible. And then you'd have an applicable cost for days 61 through 90 and thereon, excuse me. For Medicare Part A, skilled nursing costs, so this is that inpatient rehab, days 1 through 20 are covered in full. And I will say that that seems to be most commonly where most days fall within is days 1 through 20. But there are exceptions to that. I do have a couple clients every once in a while that fall into that bucket of being there for more than 20 days. When that happens, you do have a copay of $209.50 per day. After day 100, Medicare says you're no longer eligible or covered for skilled nursing care. Don't let that scare you though. If you are not getting better while in a skilled nursing facility, they then move you to another level of care. So I've, again, yet to see somebody encounter that opportunity where they expire on how many days they have available for skilled nursing care. So what is a benefit period in Part A? So most of us think of a medical benefit period as working on a yearly schedule. Part A uses benefit periods for hospitalizations in inpatient skilled nursing facility. The benefit period begins the day you're admitted as an inpatient and it ends when you haven't been an inpatient, including hospital and skilled nursing care, for 60 days in a row. So again, it is possible to have multiple benefit periods in 1 year. And I do apologize. I think previously I said 90 days, but it is 60 days. So once you're discharged, as long as you are out of the inpatient status for 60 days, your benefit period will start over again. Now, if you're readmitted within those 60 days, your benefit period from the prior stay continues and your deductible is not again applied. When we think about Medicare Part B, this is your outpatient services. So that includes doctor services, outpatient medical procedures, including surgical services, durable medical equipment, home health, diagnostic services, including your lab work, and various preventive screenings. As you can see here, there's a number of preventive screenings that are included with Medicare Part B. When you use Medicare Part B, there are some out-of-pocket costs with that portion as well. For 2025, there is a Medicare Part B standard premium of $185. You may pay a higher premium if your income exceeds certain amounts. So the Part B premium is based on your income. These income related adjustments are typically 8%. So most people will have the standard monthly premium of $185, but roughly 8% of people in Medicare will pay a higher monthly premium. Depending on what your income is, whether you are filing joint or single, will depend on what you pay for a monthly premium. So, just to give you an idea here, paying $185 a month is standard until your household income reaches between 106 and 133 as a single person per year, and 212,000 or 266 is the window for married couples. If you fall within that window, your monthly premium would go up to $259. If you have a household income of 133 up to 167,000 a year as a single person, joint is 266 up to 334. Your monthly premium is then $370 for Part B. And anyone with an income greater than 167 or less than 200,000 as an individual, or greater than 334,000 and less or equal to 400,000 as a married couple or as a joint filer, your monthly premium for Part B would be $480. There is this grid available on Medicare.gov where you can go and you can see each year what they have those premiums set at. And we will talk about this more again in the presentation, but just wanted to stop here and touch on that. When you're using your Part B services, you will have an annual deductible of $257. So that is a one-time deductible. It's not per benefit period or anything like that on the Part B side. After you satisfy that deductible for the year, there is a 20% coinsurance. As I mentioned before, some folks are automatically enrolled in Medicare. You will be automatically enrolled in Medicare if you're turning 65 and already receiving benefits from Social Security, and if you've been receiving certain disability benefits from Social Security for at least 24 months. Your coverage begins the first day of the month that you turn 65, or the first day of the 25th month of receiving disability benefits, depending on how you're qualifying. You should receive your Medicare ID card about 3 months before your 65th birthday or the 25th month of disability benefits. When you're enrolling in Medicare, you have different enrollment periods available. Your initial enrollment period is when you're first eligible for Medicare. So typically that's when you're turning 65. If you are not already signed up for Social Security, you will need to sign up for Medicare automatically yourself. You would do that through the Social Security Administration or through the Railroad Social Security if you're a formal railroad employee. There's a 7-month period, which includes the 3 months before the month you turn 65, the month that you do turn 65, and the 3 months after you turn 65. So those are your 7 months total to sign up for Medicare. If you are working past 65, and this is pretty common, you do not necessarily need to sign up for Medicare right away. If you have employer or union coverage, and that's coverage provided by yourself or your spouse who's actively working, you don't have to sign up for Medicare right away. You have what we call creditable coverage, and you can wait to start your Medicare when you either end your employment or your insurance ends itself. When your employment or coverage ends, you then get an 8-month special enrollment period to sign up without a late enrollment penalty. There will be a form that your prior employer will fill out or your spouse's employer will fill out that you'll submit with your Medicare application as your proof of having that prior credible coverage. And there are, of course, other special enrollment periods as well. So if you're outside of your 7-month initial enrollment period and do not have a special enrollment period available, you can then only enroll during what we call the general enrollment period. This is January 1st through March 31st. Coverage is effective the first day of the month after you sign up. So everything, I think you probably see the theme here. When Medicare are determining effective dates, everything is done by the first of a month. You'll never see anything start mid-month. Just to go back a moment, just to call out there that bottom bullet point, depending on when you were first eligible, if you did not sign up and you did not have other creditable coverage, you may then have a late enrollment penalty when you do sign up for Medicare. So now we're going to talk about what isn't covered by Medicare Part A and Part B. So you can see any provider who accepts Medicare assignment. So if as long as they accept the CMS, if they accept Medicare assignment, excuse me, they have to accept the CMS approved amount as payment in full. They can only charge you for the applicable Medicare deductibles and coinsurances. If a provider does not accept Medicare assignment, they may charge you more. The limited charge is 15%. They cannot exceed that, and you may have to pay the entire charge at the time of service. Here in Pennsylvania, most doctors do have to accept Medicare. There are certain rules around that, but there are some states where that would be an exception. Medicare Advantage is another part that we have available. Before I go into that, though, I do want to pause here for a moment and let me adjust my screen so I can see everyone. Does anyone have any questions on what I discussed so far before I go into more detail?
I do.
Okay, sure.
My name's Maria Boyd. I just
Hi.
wanted to make sure I heard you correctly, that you
Sure.
said you have to sign up through the Social Security Administration rather than Medicare.gov?
Yes, I know. It sounds a little crazy at first. So Medicare doesn't actually handle the administration part themselves. Social Security is truly the administrator for Medicare. So you'll sign up for Medicare through Social Security, even if you're not yet collecting Social Security. You still sign up for Medicare through them. Once you have your established Medicare card with your Medicare number on it, you can then make a portal on Medicare.gov and manage your
Hmm.
Medicare from there. But initially signing up, that step is done through the Social Security Administration.
Okay, do you happen to know if that is something that can still be done online, or do you have to go to a Social Security office?
That's a good question. If you are truly coming up on your initial enrollment period where you're turning 65, then you should be able to trigger that all online. If
Okay,
you work past 65 and you then have documentation that you need to include, like that form from your employer, then you would need to mail it. You can either call them and they'll mail you the forms to fill out and mail back, or you can schedule the in-person option.
okay. And one more question. If Can you sign up for Medicare but still continue to get your insurance through your employer? So let's say I'm turning 65 in December, but I'm not going to retire till June. I'm just making this up. Can I sign up for Medicare and still, I mean, sort of
You can.
my card? Okay.
Yeah, you
Okay.
can technically sign up. I will say though, I typically don't encourage that necessarily because there's usually not good cause for you to start paying for Medicare Part B if you don't actually need it yet. And if you're still being covered by an employer plan, that's
Mm,
usually providing you what you need as far as insurance. And so you're kind of unnecessarily paying for Medicare Part B. I have some people that just they want it and they want to sign up right away, and that's fine. You can have both. There's nothing
okay.
saying you can't have both, but you don't necessarily need to be paying for Part B right away if you already have that employer coverage.
Okay. Thank you.
Sure. Anything else, anyone? Okay. Then I'm gonna minimize this little box here and I will get back to my presentation. So when we talk about Medicare Advantage, um, that is what we think of when you hear Medicare Part C. So this is another way of receiving your Medicare benefits. If you take the option of Medicare Part C or Medicare Advantage, you're not going to actually be showing your Medicare card you're going to still have to maintain Medicare Part A and B. Those are always the anchor parts. You have that no matter what. But they become what I call the silent partner. They take a step in the background. They still have a say in everything these Advantage plans do for you. They also provide financial funding to the Advantage plans since you're still paying for Medicare, but they're not processing any claims for you. So they give money to the Advantage plans for covering you, and they oversee them in the background. So the Advantage plans are administered by individual private insurance companies. The Medicare Advantage plans are what we call managed care. So they're typically like what you have while you're working. They come in the forms of PPOs and HMOs. They have to cover everything that original Medicare A and B would cover, but they can include extras. They also would include your Part D prescription drug coverage. So you'll see most Medicare Advantage plans have that Part D prescription drug coverage included. You might see some that do not. You cannot take an Advantage plan and then purchase a separate Part D plan. You have to have one or the other. So if you truly need prescription coverage, then you want to make sure you take an Advantage plan with prescription coverage. If not, um, you would, again, you would have to have prescription coverage included with your Advantage plan. The reason why you'll see Advantage plans without prescription coverage is because there are some folks like veterans who have creditable prescription coverage available through the VA, and they do not necessarily need that. Just a moment here. So again, these often come in the forms of HMOs and PPOs. There are also some special needs plans that you might hear of. These are Medicare Advantage plans that are designed for people who are on Medicare. So they usually provide extra benefits to service that population that's on Medicare, or excuse me, on Medicaid. With a Medicare Advantage plan, again, you still pay your monthly Medicare Part B premium, and then you pay any applicable premium to the Advantage plan. You are not responsible for the actual Medicare deductibles and cost or co-insurances while you're on an Advantage plan. Again, that Medicare A and B becomes the silent partner. So everything processes through the Medicare Advantage plan, and so you're only responsible for that Advantage plan's deductibles, co-insurances, and co-pays. To be eligible for a Medicare Advantage plan, you must live in the plan service area, have Medicare A and B, provide the necessary information to apply, which includes where you live and your Medicare number, follow the plan's rules, and you can only belong again to one plan at a time. You can join a Medicare Advantage plan when you're first eligible for Medicare. So again, you have that 7-month period, the 3 months before the month you are eligible, the month of your eligibility, and the 3 months after. And then you also have what we call the Medicare open enrollment periods. October 15th through December 7th is what we officially call the Medicare annual election period. That is the time where everybody who's already in the Medicare program can make any necessary changes for the upcoming year. When you're in a Medicare Advantage plan or a Medicare Part D plan, these plans send you something called an annual notice of change in September. And that way you have a side-by-side comparison of any changes coming up in the new year so that you know whether or not you need to make any changes. If you're happy with your coverage, no action is necessary and everything just continues. There's also an open enrollment period that begins in January and runs through March 31st. During this open enrollment period, you can only decide to change between Advantage plans or leave Medicare Advantage coverage and go back to original Medicare. If you're not already on a Medicare Advantage plan, you can't make any changes during that time. But from January 1st till March 31st, if you find that the Advantage plan you're in for that new year is not a good fit for you, you can reach out to an agent or a carrier and request another plan change. So again, this just goes into a little bit more detail of what I was just explaining. During January 1st through March 31st, you can leave a Medicare Advantage plan and go back to original Medicare, or you can join another plan. If you enroll in a Medicare Advantage plan when you're first enrolled in Medicare Part A and B, you're given the open enrollment opportunity. This lasts 3 months following both Part A and B entitlement, and the 3-month period is based on your Medicare Part A and B entitlement date, not the Medicare Advantage date. You also have special enrollment periods, of course, that are applicable throughout the year depending on your own unique situation. For example, if you move from Pennsylvania out of state or vice versa, you would have a special election period to make a change. There's also extra help. Some people have changes in that extra help. Maybe they gain it or they lose it. Losing employer group coverage, I would say, is the most commonly used special election period that we see throughout the year. When you're losing or changing employer coverage, that's often going to trigger you having that special enrollment period. There is also, excuse me, a 5-star special enrollment period. During this time, you can take advantage of enrolling in a Medicare Advantage plan that has a 5-star rating. So Medicare rates all of their Part D and Medicare Advantage plans on a 5-star rating. So anyone who truly has 5 stars, and it's very hard to actually earn, but there are some plans that have that. Those plans have a special enrollment period available where anybody can join them one time throughout the year. So each person on Medicare has a one-time opportunity each year to join a 5-star plan without having any other election available. It can only be used, it says, between December 8th and November 30th because it's only applicable outside of the annual election period. If you do take that opportunity, your coverage will start the first of the following month. Any other questions before I move on into Part D prescription drug coverage?
Sorry, it's me again. I'm going to be your annoying
That's okay.
person here. So I'm just trying to understand what the advantages, no pun intended, of the Medicare Advantage plan is. Is it that it's less costly, or is it less paperwork, or I'm just
So,
trying,
yeah, and I
why
am
would
going to
that
go
be
into
better? Okay.
yeah, and I am going to go into that some more. The Medicare Advantage program, like I said, it has to cover everything that original Medicare covers, but they can give you extras. So when you have original Medicare by itself, you have those deductibles, those co-insurances, no prescription coverage, and your out-of-pocket costs when you're paying 20% of everything can start to add up quickly. If you take the option of an Advantage plan, you then have all of your benefits under one umbrella. So you pay a monthly premium to your Medicare Advantage plan, and then you have just those set co-pays like you do with your normal managed care plans that you have while you're working. And then you also have the opportunity to have extra benefits like routine hearing, vision, and dental that you wouldn't usually have. But I think that there's going to be another spot where it's going to touch on that some more. And if not, I will circle back to that as well. Okay. All right. So talking about Medicare Part D prescription coverage. So Medicare Part D prescription coverage is the portion of the coverage that provides you with strictly just prescription benefits. Medicare does not administer or provide these plans themselves. Again, these are provided by private insurance companies. Medicare sets the standards, so they say this is the structure and the plan design, and they also set the limits and caps on those. What's going to vary is going to be the formulary and your out-of-pocket cost from one company to another. So in 2025, most people will pay a monthly premium, a deductible, and then usually a combination of co-pays and co-insurances depending on your prescriptions. Everyone has the same, like I said, setup that's set by Medicare or plan design. There's a deductible stage, an initial coverage period stage, and then a catastrophic coverage period stage. When you move throughout these different stages, you'll experience different cost. So Medicare says that in 2025, the most the deductible can be is $590. You will see some plans that have no deductible or they have a deductible in between that amount, but never any more. Once that deductible is satisfied, you then move into what we call the initial coverage period. During that time, that's when you're typically going to have set co-pays or co-insurances for your brand and prescription drugs. You'll remain in that initial coverage period until your total prescription cost for the year reach $2,000. You then fall into what we call catastrophic coverage. Your coverage does not end. However, you stop paying out of pocket at the pharmacy. You still can continue to pay your monthly plan premium, but your prescriptions are covered in full then the rest of the year by your plan. To be eligible for a Part D prescription drug plan, you must be in either Medicare Part A or B. So we do have some folks who have Part A only initially, and they would be eligible for a Part D prescription drug plan. You have to pick a prescription drug plan that's available within your service area. So you won't be able to enroll in a prescription drug plan from another state, but we have multiple plans available here for Pennsylvania. You can't be incarcerated and you cannot live outside of the United States. Again, you have that 7-month period to enroll in a Part D drug plan. You also have your open enrollment period. And again, during that open enrollment period, you can leave a Medicare Advantage plan and go back to original Medicare. And if you decide to do that, you also have an election then to join one of these standalone prescription drug plans. Again, same special election periods available as the Medicare Advantage plans. So maybe you didn't have employer coverage that was providing you credible coverage, or you lost that, you move from the service area, or you have another special election period available for extra help. A lot of different options there. There can be a late enrollment penalty if you choose to not enroll in a Part D prescription drug plan and you don't have other credible prescription drug plans. If you go 63 consecutive days or more without having credible prescription drug coverage, and that could again be employer coverage, maybe VA coverage, but if you don't have anything like that and you go 63 consecutive days or more, there will be a penalty for each month you went without having coverage when you do a sign up for a plan that has Part D. So it's going to be 1% based on the current national baseline premium. So whatever the national base premium is that year, this year it's $36.78. It can possibly change each year, and it does usually a little bit. You'll pay 1% of that for each month you went without having coverage, and it's a lifetime penalty. Medicare Part D covers approved generic and brand name prescriptions, and these are approved by the Food and Drug Administration, used and sold in the United States, and used for medically accepted indications. This does include drugs, biologic products, and insulin. Part D plans must cover all drugs in all 6 protected categories. So when you look at any Part D formulary, you're going to see each category, each medication category, and they have to cover medications available in each category. But what is going to vary is those specific medications from one carrier to another. There are some medicines that do not get covered under Part D, but you still have coverage for. So that's going to be things that are administered through a doctor's office or a hospital setting. You see on this slide, we have the example of the flu shot. There is also chemo, dialysis. If you get eye injections for macular, those types of injections process as a medical claim under the Part B portion of the benefits. Again, plans must cover a range of drugs in each category, and the coverage and rules vary by plan. Formularies, prior authorization, step therapy, and quantity limits are all ways that plans can manage the formulary and the coverage. There are certain drugs that are excluded by law under Part D. These prescriptions are not allowed to be covered by any of the Part D plans, and this is a rule set by Medicare itself. We have not yet touched on Medicare supplemental. Just a moment here. So, Medicare supplemental policies are also what we call Medigap. They fill in the gaps to original Medicare coverage. This is another way of obtaining your benefits. You can have a Medicare Advantage plan where Medicare becomes the background silent partner and all of your coverage goes through the Advantage plan. However, you also have this option of Medicare supplemental or Medigap policies. These help fill in those gaps to original Medicare. Medigap policies truly supplement original Medicare. You cannot have a Medigap and have a Medicare Advantage plan. You must have Medicare Part A and B, and everything will go through Part A and B first, and then your Medigap will be your secondary insurance. I was just going to explain that you're going to oftentimes hear these plans referred to as by plan letters. More commonly today, you'll hear people refer to Plan G or Plan N. But these different plans are available to help supplement original Medicare A and B. In a Medicare supplemental plan, you'll have a monthly plan premium in addition to your Medicare Part A and Part B. So again, no matter what, you're always maintaining and paying for your original Medicare. With the provider network with a Medicare supplemental, you're truly just accessing providers who accept Medicare. So if your Medicare is accepted, your Medicare supplemental plan is accepted. It doesn't matter what carrier is providing your supplemental coverage, it truly is based on Medicare participation. There's a couple different times when you can apply for a Medicare supplemental period. You have the Medigap open enrollment period, which is a 6-month period beginning the first month you have Part B and are 65 and older. During that time, you have what we call guaranteed acceptance, regardless of your health. After that time, you can enroll in a Medicare supplemental policy in the future, but you would go through what we call medical underwriting. And during that time, I apologize, I thought that it touched on here. And during that time, when you answer medical underwriting, you would be answering questions about your health and any medications that you take. The supplemental plan could determine to charge you a standard rate instead of a preferred rate. They could also deny you coverage entirely. You would never go without having any coverage because you always have original Medicare A and B. But you also always have the option of enrolling in a Medicare Advantage plan. Those plans do not ask you any health questions. Again, there are other types of health insurance plans available that aren't necessarily an Advantage plan or a supplemental plan. You might have some neighbors or friends that are members of the VA and take advantage of benefits through the VA. There is also extra help, available through the state and the federal level. PACE is a program available. There is also the low income subsidy program, and you are eligible for both state level and federal level help. So if you get one, it doesn't mean you're not able to get the other. Everyone has a right to file a complaint or an appeal, maybe for the quality of service or for the care that's received. That's sometimes called a grievance. You can file those through your plan or through the state health insurance program. So if you have one of those Medicare Advantage plans or a Part D plan, you can actually file those complaints directly with them, or again, you can go through the state. There are programs available for people with limited income and resources. Extra help includes extra help with Medicare Part D cost. The extra help would be what I was referring to as the low income subsidy program. That's at the federal level, And then here in Pennsylvania, we also have the PACE program sponsored through the state lottery. And both of those programs can help lower your prescription drug costs for both brand prescriptions and generics. Medicaid provides additional coverage and it may help cover Medicare cost. So as I was mentioning before, the Medicare Part B premium, most people have that standard Part B premium of at least 185, but there are some people in the Medicaid program that have that covered for them. Qualification may vary from state to state, and there's different, rules and stipulations on what you have to provide for those different programs. Are there any questions? And let me just bear with me here a moment. I can jump back because I know that we didn't go too far into Medicare Advantage and Medicare Supplement and maybe touch on that just a bit more. So when you have a Medicare Advantage plan, as I mentioned before, you're going to pay for your Medicare Advantage monthly premium, and then these managed care plans have their own copays. These monthly premiums are typically lower monthly premiums than the Medigap premiums, those supplemental premiums. There's no right or wrong. I tell people it's usually pay now or pay later is a good way of looking at it. With the managed care Medicare Advantage options, you're usually paying less out-of-pocket cost because you're paying less for a monthly premium and then you just have copays when you use the insurance. Depending on your health would depend on whether or not those costs are going to be a lot or a little each month. With the Medigap program, because you don't typically pay copays and coinsurances, you're having very little out-of-pocket costs, you usually pay a higher monthly premium. Again, no right or wrong. That's where you would want to get with a trusted agent or an advisor, somebody like myself, or maybe somebody else that you know that can help you narrow down your different options that are available to you to help you determine what the best option is for you and your needs. Um, it can be a matter of personal preference, health needs, financial needs. Those are all factors that are going to drive you in determining whether Medicare Advantage or Medicare Supplemental is a better option or better fit for you. Is there any other parts of the presentation that anybody would like me to jump back to or any questions?
I have a question about the supplemental plans. I thought I saw that it was there was a phrase that said it was guaranteed. This might have
Guaranteed
been,
issue. Yeah, give me one moment here. Let me see where that was.
I thought it had to do with the Part D.
That would have been in reference to Medicare supplemental coverage, the guaranteed acceptance. And what that's referring to, oh, I put some slides in there, is when you're first eligible for Medicare Part B, like boy, you have what we call 6-month guaranteed acceptance into a supplemental plan. After those 6 months, you typically have to go through medical underwriting.
Okay, that guaranteed issue rates. No, that I thought it had to do with. Never mind. I'll see if I can pull it
With
from my.
Part D, as long as you're eligible for at least Medicare Part A or Part B, you're eligible for Part D, and you just have to sign up during an election period. But otherwise, there's no restrictions regarding your health in that regard.
Okay, thank you.
Okay. Thank you so much, everyone. I greatly appreciate your time this evening, and I hope that this provided you a little bit more clarity and some direction when it's your time to talk about your options.
Yeah, Heather, thank you so much. And certainly, if anybody else does have any questions, please feel free to jump in and ask. We do have some remaining time, so and I know Heather's happy and willing to hang out here with us for a little bit.
Absolutely.
Maria, you did a great job. Well, first of all, let me back up. Heather, thank you so much for that presentation, and you did a really great job of going through all those different moving parts. And I think what Maria did also, and thank you for your questions, Maria. She just really, showed and shared that everybody's situation is personal and there are a lot of moving parts. And so it's so important that you can have a reliable resource, somebody like Heather that can help you through this process. I know for me, although I'm not, at this place yet, this would be overwhelming to me. There's a lot of moving parts. There's a lot of different decisions to make, and thankfully, people like Heather know this kind of stuff inside and out. So we're happy to bring reliable resources to you. That obviously again can help you with this type of planning. Um, Heather, the one question I wanted to ask for you or of you is, um, do you have any insight yet on changes that are coming within Medicare coverage in any way for 2026? I know that you have to go through a whole lot of training from year to year. I don't know. I thought you said it was around this time of year, maybe September,
Yeah.
or even
I
maybe
was gonna say,
prior.
yeah, we're pretty busy. Yeah, right now that's what we're pretty busy doing outside of day-to-day work is the different carriers are starting to provide us our certifications. No one's really given us benefit information yet. They like to hold out until the 11th hour on that. And honestly, as a licensed agent, we are truly not allowed to speak about anything until truly October 1st. What I can tell you is we have seen some industry changes this past calendar year. I'm not sure how many of you are familiar with the Part D coverage gap or donut hole that used to exist. During that time, you had a lot more exposure for your prescription cost during this gap, or people called it the donut hole. The out-of-pocket maximum also used to be a lot higher. It went up to $8,000 and more at times. This year in 2025, we actually saw the Part D out-of-pocket maximum come from $8,000 down to $2,000. For people who were spending more than $2,000 a year for prescriptions, that was a huge move in the right direction. It really helped cap and make prescription costs more affordable for those on Medicare. However, the insurance companies really had to find their new normal in absorbing that $6,000, you know, change from that benefit period. We did see some plans go from having brand name copays to co-insurances. So instead of having a set copay, you're paying a set co-insurance now. So some people might hit their out-of-pocket maximum a little bit faster for prescription coverage. But what I'm getting at is because this was a big change for 2025, I think all the insurance companies are sort of trying to find their new normal. So I expect to still see a little bit more movement than maybe what we normally do this coming annual election period. Um, so just be sure if you are in the Medicare program or it's coming up for you to keep an eye out on what's available to you and get with someone that can help you, look at your options and really find the best fit for you and your needs.
Thank you, Heather. So,
Sure.
Heather, could you also please explain, because I know this is important for people to understand too, how is it? And by the way, thank you for putting your contact information there here in this final slide. For
Sure.
anybody that has not noticed that yet, Heather's contact information is on the slide. Um, and I mention that specifically because Medicare has certain rules that they have to follow and go by in terms of how either Heather contacts you or you contact Heather. And so, Heather, could you explain how that works? Because I know that that would also be helpful for everyone on the call to understand as well.
Sure. Sure. So to protect you as a consumer, Medicare says that I cannot reach out to you unless I already have your permission. Um, Unfortunately, I do hear from people that tell me they get these automated phone calls of people trying to advertise benefits to them. I really encourage you to, shy away from those calls. Um, I- Not sure how that all comes about, but a compliant agent cannot reach out to you without you first reaching out first. So even if you say, "Hey, my friend Joe really wants to hear from you," unfortunately, I can't call Joe unless he reaches out to me first. So I always tell folks, please don't ever hesitate to reach out to me. Call, email, whatever works for you. If you want to share my contact information with somebody, feel free to share my contact information. Once they reach out to me, then I have the green light and I can follow back up with that person.
Great. Thank you, Heather. Heather, I did forget that I wanted to ask you this question, so I hope I'm not putting you too much on the spot here, but I wanted to share with the group on the call, because this could also, happen to anyone on the call. In my own personal case with my mother years ago, she had, I believe, a supplemental plan. And then all of a sudden, somebody doing door knocking, going through the neighborhood, offering Medicare programs, knocked on the door. And, my mother was not, um, how should you say, she was a bit vulnerable. And so she already had one supplemental program and shared that with this individual, but this individual talked her into signing up for yet another supplemental program. And so somehow or another, she ended up having two side-by-side supplemental plans, of which I still don't understand how that was feasible or possible, but she was paying for both.
It's
And
actually illegal now.
yeah,
I'm
and
not
and
sure when that became, but yeah.
yeah, and so here's where I'm going with this. Not only was that confusing to me, and not only when I tried to contact the agent, I got a runaround. So, again, having a reliable resource is super important, somebody that you can trust. But then I also contacted the insurance companies themselves. Well, by this time, my mother had Alzheimer's dementia, and um, she was in the early stages of this at the moment. But unfortunately, my mom kind of gave the impression that there was somebody in the background helping coach her along the way in the conversation because she did not know how to approach the conversation. And unfortunately, my parents had powers of attorney, but they never signed the documents. And they also never provided the insurance companies with the POA documents. Even if they would have been signed, they still never provided it to the insurance company. So the minute the insurance company realized, the representative on the phone realized or thought that there was somebody in the background coaching her, they hung up. They would not
Oh,
talk to us. I tried repeatedly to get them to cooperate or to help, and they would not. So my mother ended up with two policies, paying extra each month, and I was stressed out not knowing who was going to be paying what and who it would actually be, who would be the first payer. So this comes back to the importance of the POA side and having that document in place and signed. But Heather, can you tell me, or tell all of our guests on the call, how does that work if you want to make sure that, the insurance company has knowledge that there are active POAs in force
yeah.
that that they would need to have on file. I mean, how does that work? How does the insurance company accept that, or how does that work so that if mom or dad or grandma and grandpa or somebody gets into a jam and somebody in the family needs to be able to help them, how do they do this?
Yeah, that's a great question. So you have a couple different ways you can go with that. If you do have a power of attorney already on file, written up with an attorney and signed, my goodness. I always tell folks when I'm working, it's not uncommon for me to work with a client and a family member who's helping them navigate the process. And if that happens, I'll always say if you have a power of attorney, once you get confirmation that you've been accepted into the plan, send a full copy of your power of attorney into the insurance company. The insurance company will actually have your power of attorney validated by their legal team, and they'll then put that on file and have noted file of who they can talk to from that power of attorney. And they truly follow those power of attorney files. If you don't have a power of attorney, you can still put an authorized representative on file. I tell people in that instance, you can call your insurance carrier, call the number on the back of your card at any time and say, I want to assign an authorized representative. They'll ask you some questions, they'll send you a form to sign, you send it back, and so you can have somebody just appointed on your health insurance account um, to help you navigate that. I know I help my in-laws, and I'm notated it as their authorized representative on their account without a power of attorney. We didn't need all that at this point. But it still gives me the flexibility to help them without them being available, or if heaven forbid they're incapacitated and not able to be a part of the call.
That's great information, Heather. Thank you. Because I gotta believe there's a lot of people that may fall into that situation to where they just don't know, how to move forward in those situations. And by the way, uh, nobody, when I made all those calls, both to the agencies as well as to the insurance companies, not one of them said that you could become an authorized person, to help that covered person on, with that coverage.
So I'm really surprised to hear your experience was handled that way, especially by the carrier. My roots originally start in a call center, in a Medigap call center at that. And I can't tell you how many times I was on a call with somebody where I was like under my desk hollering for them to hear me. And I was always so thankful when they finally had somebody to help them in the background, help them navigate something. So I'm not sure that's necessarily always the experience, but there again, there's no guarantee from one carrier to another. Even I have folks tell me, oh, well, I dealt with company X, Y, and Z with my employer coverage for 10 years. Well, you can't use that necessarily as a comparison when you go into the Medicare world, because then the Medicare segment with all those companies is handled separately.
Right.
So everything is really unique and custom in the Medicare world. There's a lot of set rules and regulations that don't apply outside of the Medicare world. But I said definitely be proactive in that situation. At least have an authorized representative on file. So if something happens and you are hospitalized, somebody can call and ask questions and speak on your behalf.
That's great. Great, good insight, Heather. Thank you so much for that. And we are actually approaching the top of the hour. Um, I think what I heard Heather saying is that if you have additional questions from what you learned here this evening, please feel free to reach out to Heather. Again, her contact information is on the slide. Again, I know that Heather would be happy to reach out to anyone that is on the call, but unfortunately, Heather, if I understood you correctly, she's not, allowed to reach out to you. You have to reach out to her, and she'll be happy to help you. And I would assume that obviously works for anybody else that you all may have in mind that you'd want to work with. Hopefully, this evening you learn that Heather is a really knowledgeable, very caring, and very nice individual to work with. And so, Heather, we thank you for your time this evening. Um, Gosh, I think I know that this conversation could keep going, but I think we better end it here. And we're
Yeah.
very grateful for all of you joining us this evening as well. Hopefully, you found some value, some clarity, and some confidence in this conversation tonight, and encourage you to reach out to someone you'd feel comfortable with additional questions. One last thing, Heather, if anybody reaches out to Sebastian or myself or to Josh as their advisors, and say, hey, could you have Heather contact us? Is that a form of permission or not?
It's really not. I can email though. So if you want to pass your email along to one of your contacts there, I'm allowed to communicate by email because I have an opt-out option in my email.
Okay,
So if that happens to come up, I can certainly touch base that way. But if you would like a verbal conversation, give me a call or send me an email and ask me to give you a call. I am happy to talk to people over the phone, through Zoom. If you're local, I'll meet with you. So, whatever works for you.
great. Well, again, thank you so much, Heather, and thank you to all of you who joined us this evening. We appreciate your business and your confidence and trust in us here at Premier Wealth Management. And we look forward to offering additional calls like this. So please certainly look forward to, additional invites, that obviously would involve different topics. And again, we just thank all of you, and we'll talk to you all again soon. And enjoy the rest of your evening, everybody.
Thank you, everyone. Thank you, Mark.
Yeah, thank you. I'm sure after some of this stuff percolates, I'll have questions.
Sounds good.
All right, take care, everyone. Thanks again.
You bet.
Bye-bye now.
Bye bye.